it makes me think about those ordinary moments, right? The day-to-day activities that we engage in just as we navigate our daily life, and how do we incorporate mindfulness, meditation, and moments of pause and intentionality within those ordinary moments so that they don't become an additional task, but rather integrated and small pockets throughout the day to help inform a more resilient sense of self and community. So Dr. Sharma, as you have come into this as a resident and now a chief resident and also as part of the faculty of the Humanism Project, what is the impact of this on you personally? And what have you seen amongst your colleagues?
I think something that you mentioned is that sense of community. We're lucky enough, and I've been in that transition where I've spent 3 very fruitful years, serving and working at Maimonides in Brooklyn. And, now I am on the other side where I see, something of a, not of a challenge, but as a project or as, something that we can give back to the residents. We have residents coming in from every walk of life, every culture around the world. And to kind of, have that sense of community where you can pick up a single word, a single sentence, a single phrase that can help you connect better, not just with the patient, not just with your colleagues, but just amongst ourselves as well. That's that's the kind of camaraderie and the sense of belonging that, as physicians we need when we're doing, our day-to-day work. So, I think that communication, that sort of self-awareness and that wellness is all amalgamated pretty well into the structure of humanism. And so it could be as generic as just a session where someone who's been through or who's had a rough time working in the hospital can just kind of offload whatever's on their mind and then get that support. But also if someone's coming in with a certain scenario where it's difficult, they don't know how to communicate in a certain situation, we have role play, we have language tools, we use all these kind of simplistic modules to just help make our job kind of very human. It adds that kind of, I'm pressing on the word human, but it's very important to belong and to believe in that for us to take care of patients who we truly really want to give our best to.
And how has this transformed the impact in working with patient care in particular?
Because you don't see them from a chart perspective. You don't see them from a diagnosis perspective. You see them as a person who's coming in with an issue where you have the knowledge, you have the tasks, you have the scans, you have everything to kind of process the affliction. But that person, you also need to kind of, talk to or cater to, or just hold their hand when they're in their, a state of insecurity, a state of, their worst possible. Nobody wants to be in the hospital, but they, even if it's like, how was the day yesterday, how was the game, something about their culture, something about their faith, something about anything that can help us and help, because then they trust us and we trust them, and that helps us take care of each other, because a good patient is as important to my own wellness as I am to theirs.
Absolutely. There's a reciprocity there. So
yeah.
Thank you for that. So Mark, I want us to go back to our meeting that we actually had here at the Garrison Institute. It was the first time I met you, and we started thinking about actually this forum. And through our conversation, the title emerged, Peak of Resilience. So I want to tap into your point of view in terms of April of 2020, of this year, which was also the peak of COVID. But yet we landed on this title, Peak of Resilience. What's the significance of that?
Yeah, I remember that very clearly now. It was, well, to be honest, there was almost a tongue-in-cheek with it as well. I think the question that you had asked me is like, what did you do to sort of maintain resilience during the peak of the COVID crisis, during the surge? And I sort of went blank, because they didn't really need outside techniques during that time. That was when they were at the peak of their resilience. it was amazing to watch, you know, when a group of people have like a sense of mission and they knew what they had to do, they rose to that occasion. And in many ways, that's truly when they were at their peak of resilience. And I think that's an interesting discovery for me. You know, it's not, resiliency isn't some sort of outside object. It was a capacity they already had. And through necessity and, you know, hopefully some of the training that they get from us, they were there. They were truly at their peak during that time. People were very nervous before the surge. And during the peak, it was amazing to watch them work. And then when things started to slow down a little, you could actually even see resiliency start to sag a little bit. People were tired. So that's where it's almost a pun, but truly in April, they were already at their peak.
And it makes me think of how the foundation that was already set within the hospital setting through the Humanism Project, through the training, through the workshops, through the sense of belonging, really helped to facilitate, right, that resiliency when you were at a peak of a crisis. And we are still currently in a crisis. So Dr. Sharma, from your point of view, what was happening? What were you noticing? What were you becoming more acutely aware of during this time? Let's go back to April.
So I think, and I was a third year resident, so I was nearing the end of my residency. I was looking forward to chief residency. So it was a sense where during that time of the training, everyone's focused on their what's next for me? What's next for, you know, this and that. And, you know, when this happened, obviously nobody believed that this will happen to the peak that it did. You know, certainly, you know, I didn't. And when you started going to the hospital, when I remember going to the first COVID rotation that I was assigned, you had the sense of fear. You had the sense of your own mortality, which is very rare as a physician for me to go take care of someone in the hospital where I'm concerned about my own self. And there was fear, there was anger, there was, you know, so much and it was amongst every one of us, but that dissipated. Once it started happening, once you're in the hospital, you saw every one of your colleague, every peer of yours, and not just physicians, not just residents, PCTs, nurses, everyone in the hospital just come together, focus on one thing, which is how to best take care of each other and our patients. And that kind of coalesced us into this one entity, which, you know, was a beautiful thing that happened organically. The one thing that I remember was we were in full gear, full PPE, wearing our masks, and, you know, going through patient after patient, room after room. And it was just two people who used to take a break, go to a room in one of the corners. And as soon as we used to take off the mask, that breath of air was something that it was the most fruitful part of that day, was when you were able to actually take a breath and look at your person, look at, you know, the other person in the room, and just not even talk to them, just smile and be like, you know, yeah, it felt good.
I know in a previous conversation we had, you actually described it as the breath of air was something new.
Yeah, it was like a breath of air that you've never taken before, because it was so cherished. Wow. And, you know, and when we'll also see that our patients, or the people that we're taking care of, are gasping for that precious pair of, you know, breath of air, that you start, you know, cherishing life. You start cherishing whatever we have, and the whole situation, the whole what's next for me goes away, and, you know, we all come together and work towards one goal.
Mm-hmm. And when you left the hospital, how did you build in some structures around balance as you transitioned from, you know, the very high octave, right, of the work environment and transition to your home environment? What were some of the things that you used to really structure some balance so that you weren't carrying the load, if you will, of the COVID pandemic and what you were experiencing in the hospital?
Personally, no television, nothing. You know, everyone had a routine going back home as well. You have your separate clothes, you take a shower, you get back, because we had families that we had to get back to. You know, everyone had, you know, someone that, you know, they were really concerned about just because we were working in the hospital. But the other thing that, I truly realized was relationships, not just in the hospital, but outside of it. So I was connecting with, my family members, my parents more often, just trying to check up on them, because this is going on, this was going on across the world. It wasn't like you could escape to a mental place, or you could escape to a physical place where this wasn't happening. And so, just poetry, just listening to music, just going back to some sense of a happy place. And all those, even if it was a fraction of a minute, it was worth it. And, you start collecting those memories, and, the human mind, I think, starts kind of, you have to make the effort, but starts gathering that peaceful kind of serene setting that you can go to. And, we practice getting there, and meditation certainly helped. Music, reading books. Finally, I picked up a book which was not related to medicine.
Right.
So all those things, really helped. And just conversations like these helped so much to just kind of heal us every single day.
And what about the community care piece? So we've seen 7 o'clock clapping of hands and pots and pans coming out, and all of these meals that were coming to your doors. And these are just some few examples. How is the community care a facilitator for self-care during that time?
It was immense, like, and we got so much love from the community. Walking, I have a short commute, but walking back home, everyone appreciates. And even the one thing that I really go back to, and Dr. Wolf and I were talking about this today, was every time I used to, because families weren't allowed to visit. And so every time we used to give an update to each family member every day. And we weren't used to it. I'm not used to it. And they would ask us, how are you doing today? And that simple question, like, they knew, they understood, and they asked how I was doing today, and they also used to be like, take care of yourself, be safe. And in a moment, that kind of made it worth it. That was, the appreciation that kind of made us keep going for it and keep doing it.